his medical degree from the Uniformed Services University of the Health Sciences School of Medicine, and a Master of Public Health from the UC Berkeley School of Public Health. Dr. Jeff?
Good morning. Thank you for that kind introduction. It's a real pleasure to be here. On behalf of the Los Angeles County Department of Public Health, I really value this opportunity to come speak to you about our experience with measles, and I really want to thank the Big Cities Health Coalition for organizing this to provide you information. You know, we're talking about a set of diseases here that really do matter, and I hope you all feel this personally, because what we're striving to do is create communities that are really healthy and safe. We're talking about two diseases today, measles and Ebola, really where the norm in our community is to have 0 cases. And to provide a little context about this, many of you know that smallpox was a severe problem for many years. That was eliminated nearly 40 years ago in 1977. Tremendous success of an international public health effort. Another major health problem was polio, which you know has been eliminated from the Western Hemisphere for many years, and there's a concerted effort by the world to eliminate that. There's still some countries where that poses a threat. And measles is close in that category. Measles is a major killer of children throughout the world, and we as a nation were able to eliminate this, as Dr. Rita just said a few minutes ago. So think about this. These are diseases that have been major challenges, and we're really close to eliminating them. And so as a nation, we're continuing to struggle with how we implement these final strategies that continue to keep our communities safe. And so as the big cities with resources and lessons learned from these, we bring these to you so you have a good understanding of what we're trying to do here. So as a result of my talk, I hope you understand a little bit more about how measles happened. I realize here in the district, while you did have some cases, you didn't experience it like we did in Southern California. I also want you to appreciate that measles is a serious disease. I hope you understand that there's really 2 strategies that we have to try to contain measles outbreaks. One of those is under my control, and we do all we can, and the other one really isn't, and that's where I need your help and support in enabling us to be better protected. So I think you all know about measles. Looking around the audience here, I assume that most of you have never had it. I had it as a child, but it could be that there might be 1 or 2 others here that haven't had it. So none of you have personal experience with this because it's just a very, very rare disease, but it is very serious. In nations where there is no immunization program, up to 3 or 5% of children actually die when they get measles because they're severely malnourished, and measles is a disease that can lead to their death. Here in the U.S., of course, that's not exactly the case, but it is a very severe disease. Many of you know that it causes a cough, it causes a runny nose, you get red eyes. And then about the 7th to 10th day, you develop this rash that begins on your face and spreads throughout your body. And then you're very ill for quite a while. Most people recover and immune for the rest of their life, but a small percentage of people develop very severe consequences. They develop pneumonia, they develop an infection of their brain called encephalitis, and 1 in 500 or so will actually die from this disease. So it is a very, very serious health problem. It's also very infectious. So out of the 40 or 50 people in here, let's say 10 of you aren't immune and I actually was ill with measles, it's likely 9 of those 10 people would actually come down with measles as a result of being in attendance today. So it's very, very infectious. So what happened in California? Well, as many of you have heard, we first became aware of this a little over 100 days ago. On January 7th, the California Department of Public Health released information about an outbreak of measles that had started in the Disneyland parks in December. When they looked at the cases, all of the initial cases that were identified had been in Disneyland on 1 of 4 days between January 17th and January 20th. So then over a period of the next 2 months or so, there was a total of over 160 cases throughout the nation. This spread to affect 19 states and also the District of Columbia. In the state of California, we had over 130 cases. So there were 42 cases directly from exposure at Disneyland parks during that 4-day period in Disneyland. There was another 30 cases in California that were direct contacts or worked closely with those cases. There was another 15 who just happened to pass through an area where one of those cases had been. They had no direct contact, but became infected. And there was another 31 or so for which we could never figure out how they were exposed, but we're certain that they were exposed as a result of those initial cases. In LA County, we had, in our jurisdiction, 28 cases of measles. We have 2 other health departments in the county, Long Beach and Pasadena. They had 6 additional cases between them. Of these cases, 14% were hospitalized. And one of the cases was very severe. So out of 28, one of them was an adult who ended up in intensive care for an extended period of time with very severe pneumonia, and who is still getting some occupational therapy because of the symptoms and problems that that person had. 11% of these folks were healthcare workers, because where do people go when they're sick? They go into a clinic, and so of course healthcare workers are going to be exposed. The mean age was 22. While we talk a lot about this is primarily a childhood issue, in fact over 60% of the cases were adults, over 20 years of age. And 54% of our cases were not vaccinated. Now, just remember, we're in the midst of this Ebola thing at the same time while measles is going on, so I still have my 10 to 12 cases I'm monitoring a day, and people with fever, and, of course this is flu season, and people with fever are very common, in LA County with 10 million people. If we have 10% influenza, that's 1 million people with fever, and then there's all kinds of causes of rash. So you can just imagine teasing out these 20 cases of measles in the context of all these other things going on is very, very challenging, even for a health department like ours. So while we ended up with 28 cases, we actually had 450 individuals we suspected had measles. People with fever and rash, and we had to do an investigation. And on top of that, we ended up with over 2,200 contacts. So just imagine, between the period of the first week of January and the first week of March when the last case occurred, that's about 40 to 50 individual contacts a day that we have to investigate. It's a huge amount of work. So then I'll talk about that a little bit more. If you haven't heard, the outbreak was officially declared over 2 Fridays ago, on April 17th. That day is determined because it's 2 incubation periods since the last case. The last case actually had rash onset in early March. If you add 42 days to that, that puts you up to April 17th. And so the outbreak was officially declared over on that day. There's a lot of roles that public health departments have in responding to an outbreak like this. I think most of those roles have already been highlighted as we've talked about Ebola quite a bit. But it really, I hope you appreciate that it really is the public health departments that really are leading the response in the community to get them back to the point of being safe and healthy, which is what we're all here about. So the first role we have is providing information, as has been said. So for measles, I convened a couple of press conferences, got all the media there, we get our website going, I hold webinars. I've got 27,000 licensed physicians in the county. How do I reach out to them? I've got 100 hospitals, 88 school districts, 80 cities. It's a real challenge to reach out all those communities and provide them information about what's going on. Clarify for them what roles they have and what the tools are we're providing to help them do that. So that's a big role, and it's really extraordinary amount of work. Then there's clinician education, because doctors haven't seen measles. So somebody could walk in with a fever and rash and not even think of it, so we have to provide them information to think about that. And then of course, as they suspect a diagnosis, they need to know who to contact, and we provide the laboratory testing to support the diagnosis. Then there's the surveillance role. So we have to have all of our antenna up to try to detect cases as they occur so that we can quickly identify them and confirm them as cases. And then there's the work of the actual case investigation and the contact investigation. So a primary strategy of preventing further spread is isolating somebody who's infectious. So we want to identify that case immediately, put them at home or wherever they can be, and restrict their activities so they don't expose others. And then of course all those contacts, we look at them to monitor if they develop illness, because we'd be concerned about that. We also actually would quarantine them. So if they're going to go to work or they're going to go to a school, we're going to say no until you're through the 21-day incubation period, you're restricted from certain activities. And so we monitor them to make sure that that is done. In addition, some of those individuals are actually eligible for preventive therapy. Some of them could be vaccinated or receive immune globulin, which would prevent them developing measles. But that tends to be the exception, because it would have to be identified within very few days. So to respond to an outbreak like this, you kind of understand what we need. We need adequate staffing. You know, one of the challenges in Los Angeles County, most people speak a language at home other than English. So over 5 million people are speaking Spanish or Chinese or another language. So we have tremendous challenges just in translating messages and providing an appropriate cultural context and so on and so forth. But there's a huge amount of staff that are needed. We also need clinical staff because we have to talk with the clinicians in the community and communicate what's going on and provide diagnostic support as needed. Communication staff, as I mentioned, is very important. We also mentioned the information management challenges. These really are overwhelming. As has been discussed, we use what's called the Incident Command System, which is a nationally recognized approach for health departments to efficiently organize and respond to emergencies. I've led our Incident Command System several times over the last few years, including Ebola and some other things. So we immediately got into this mode. I have about 40 staff who directly are part of that, and then we have scores of other people in the department who are helping us with the investigations and with the information management. It's really a huge task, and LA County is one of the few health departments actually in the state that has these kinds of resources to do this. We also do the lab testing. We have an extraordinary public health laboratory in Los Angeles County. The kinds of tests that are needed to diagnose measles, polymerase chain reaction test, which is very specific for that, is not a test that's available in clinical laboratories elsewhere. So this is something that's very valuable. When we stood that up, then other counties around us were able to use that laboratory in order to quickly make diagnoses and make decisions on how to manage people. Some of the other things you need to know is measles is a respiratory airborne transmitted disease. So if I had measles and I left here, the virus would continue to float in this room for up to a couple of hours. And so when they go into care facilities, our partners need to have negative pressure isolation rooms where they can put these individuals so they won't spread and affect other patients or staff who are working there. And of course we need a large stockpile of immune globulin and vaccine. I will mention that the 317 vaccination program, which is something that I know is scheduled perhaps for some cuts, was very helpful to us because it does allow us to use vaccines to immunize adults and children who otherwise aren't covered by certain programs. So that was a very valuable asset to us in responding to this outbreak. So, as I said, there's really two ways in which we respond to measles. One of them is the work we do, identifying the cases, identifying the contact, hopefully isolating them and preventing